maybe in your cadaver, you can't see the frontal sinus yet, frontal recess yet, because everything is like obscured by the frontal process of maxilla, so you can't see this. And then you can see the anterior ethmoidal artery, right? In some cadaver you see already, and then posterior ethmoidal artery. How you want to identify the anterior ethmoidal artery and posterior ethmoidal artery? So first, you have to find the frontal sinus, and then after that, there is one S cell here, a space, and then after a space, then you find the anterior ethmoidal artery. Anterior ethmoidal artery is mnemonic plumb. Posterolateral, anteromedial plumb. Posteriorly must be lateral, and then anteriorly must be medial. So plumb, yeah. Posterolateral, anteromedial. So it's like that, yeah. Posterolateral, anteromedial. So it must be oblique like that, yeah. And then the posterior ethmoidal artery is straight. So sometimes there is an intermediate ethmoidal artery is here. But that one is a variation. So most of cadaver don't have, but some cadaver will have. So frontal sinus, there's one S cell here, and then look for the anterior ethmoidal artery. And then there is one S cell free here. That sometimes there will be an intermediate ethmoidal artery, and then if not, it's also that cavity, one cavity here, and then after that you look for posterior ethmoidal artery, and then there is one cavity here. And then you see the anterior wall of the sphenoid. So this one is sphenoid. And this one is sphenoid. I forgot to write. This is sphenoid. So if you lost, you must go to the frontal sinus and then see one S cell, ethmoidal artery, one S cell, posterior ethmoidal artery, one S cell, sphenoid. That is the normal variation. It's not variation. It's a normal anatomy of the skull base. So always if I cannot find my anterior ethmoidal artery, I will go back to frontal sinus. Frontal sinus, in real life, you cannot open up bigger. You cannot touch the mucosa of the frontal sinus because it will stenoze. So usually we just remove the polyp and then we leave it. Once we touch the mucosa around the frontal recess, there will be scarring and adhesion and all that. At the end of the day, we have to do dot prop. So when we do when we do endoscopic sinus surgery, when we remove the anterior wall, actually this one is what do you call that? The lamella. So there are 5 lamella that guide the whole skull base. The first lamella is lamella of the uncinate process. The second one is lamella of the bulla, anterior wall of the anterior ethmoid. The third one is basal lamella. Yeah, that formed by the middle terminate, it turn like that to basal lamella. And then the fourth one is lamella of the posterior ethmoid. And then lamella of the anterior wall of the sphenoid. So 5 lamella, you can see, when you open up, you can see all these lamella at the skull base. So you have to look for that. And then if you see here, this one is the second lamella, the lamella of the anterior wall of the bulla. So behind that is already anterior ethmoidal artery. So during surgery, endoscopic sinus surgery, a normal one, we don't remove this fully, superiorly, because this one will protect the anterior ethmoidal artery. Because usually when we do surgery, if we find the anterior ethmoidal artery is already injured. So usually we don't look for anterior ethmoidal artery because we don't want to injure it. And so it's protected by the anterior wall of the bulla. So if let's say you remove all till the skull base, you have done frontal sinusotomy type 1. Then you remove the anterior of the bulla fully, then they call that frontal sinusotomy type 1. That means the frontal recess is already open up. Yeah. So that one is for the skull base. Any question for the skull base? So look for this one when you open up, you find this, nicely you can see this one when you open up the skull base later. So to find this, you have to remove all the mucosa at the skull base. Remove the mucosa and identify your artery slowly and nicely. And then, okay, so these two diagram is actually for external. So external, I think I will explain later because nanti susah pula kan. So I will explain later. And then after this, remove everything and see the skull base. And after that, we do the orbital decompression and optical decompression. Correct. So start that one first. I give some half an hour like that for you to